sponsored by Springfield Clinic.
Joining us this Wellness Wednesday is John Belz, MD, Springfield Clinic Pediatrics, and today we're talking about RSV. Thank you for joining us.
Happy to be here.
All right, now along with cold and flu season, we do hear at this time about RSV, especially in babies. So just what is RSV?
Yeah, so RSV is respiratory syncytial virus. It's a type of respiratory virus that especially affects young infants and babies and results in a lot of hospitalizations. So that's why we care about it as pediatricians.
Yeah, and just what are the symptoms of RSV?
Yeah, so it is a respiratory virus, so in many people it would cause cold-like symptoms, runny nose, cough, congestion, but in young babies the issue is that can cause increased work of breathing, retractions where you can kind of see the chest caving in, then breathing rapidly, and low oxygen saturation, and that usually can result in hospitalization.
And just who should get an RSV vaccine?
Yeah, so there's new RSV vaccines that have come out actually in the past couple of years, so it's important to kind of get the word out about those. One of those actually is given to moms when they're carrying the babies between 32 weeks and 36 weeks gestation, and they actually can pass the antibodies through the placenta to the babies and offer protection. The people that we're most worried about are newborn babies, anywhere from just being born to 8 months of age, entering their first RSV season. That lasts from November through March. And so one way, like I said, is through the moms getting the shot and then passing the antibodies to the baby. And then an additional way is we do a shot that just has the antibodies to give to the baby, and that's born to newborn babies entering their first RSV season, and then that offers protection against RSV.
And just how does the RSV vaccine work?
Yeah, so like I previously touched on, the mom's getting the shot that uses the body's own immune system to make antibodies against RSV, and then they're able to pass those antibodies to babies to offer protection. And then in the case of the babies getting the shot, it's actually, we just give the antibodies that offer protection. That lasts for 3 or 4 months at a time, and we do it during the time where they're most at risk, which is going to be the respiratory season, November through March. And what we're trying to avoid is hospitalization from RSV. It doesn't protect against getting the infection, but what we're trying to avoid is an intensive care stay, needing a breathing tube, those severe cases kind of in those young, most at risk babies.
And just where can we learn more about RSV and the available vaccines?
Yeah, I think the CDC website is a good place to start. It has a lot of good information. And the other thing, I think you could talk to your physician, someone that you have a relationship with that you could trust, talking about risks and benefits, which you should do for all medical treatment. So whether that be your pediatrician or your obstetrician or elderly people can get an RSV vaccine as well. I don't know as much about that as a pediatrician, but you should talk to your doctor about that.
All right. Well, thank you so much for joining us and providing this information.
All righty.
Thanks for watching. Stick around by subscribing today and don't miss a single video.